with the client prone, I'm going to do some work all in the upper traps, around the deltoid, and then through the triceps and into the forearm and out the hand. I want to start with some fascial release work, some connective tissue work. So I am going to start without oil. I don't want any lubricant on the tissue because I want to drag that fascia with me. So we're going to begin by taking the arm off the side. Yeah. And then now we've got access right here to the triceps. And I'm going to do a little bit of skin rolling and pinching and lifting, just to kind of start getting some circulation going in there. And then I'm going to do a fascial glide down, and I'm going to take my opposite hand and separate teres through the triceps. Is that okay? It's a little pulley, yeah, a little pulling. But here I'm dragging the fascia and anchoring it here to the body, and then I'm gliding down here, doing that little fascial drag through the triceps. Now I want to be mindful when I release that, I want to do it a little slowly. Fascia has what's called elastic recoil, and so if I'm pushing really hard on it and I let go too fast, see how our whole body kind of jiggled? That's not recommended. We don't want to do that. So I'm going to anchor that scapula. One head of the triceps goes in between the teres major and minor, kind of up here in the armpit. So we're going to anchor that there and then glide down one more time. Great. And I'm going to do some scrubbing. Just some knuckles scrubbing, increasing the circulation. Is that okay? And you can see that her tissue has this nice blood supply going now. That's just what we're going for. And then the last fascial thing I'm going to do, take my thumbs down that back of the armpit and traction those heads from away from that corner of the armpit. So I trap and traction down toward my body. Nice and slow. Pin, traction down, and glide nice and slow. I'm just going to do that a couple more times. Now there's a trigger point in teres minor right here. So I don't want to go into the body. I want to be flat and traction. And glide. Doing all right? Does it feel good in any way? Oh, good. Great. All right. See that? It's just like a heavy hand. I'm sinking my body and tractioning that away. Great. And then I like to give a little squeeze and compress. Right. And then now I'm going to bring this arm back up on the table. So now with the arm back up on the table, I'm going to place some oil and drag all the way down to the fingers. I come up the traps in the shoulder, cross those upper traps, and then glide down and out the fingers. Top of the traps, kind of squeezing the arm in between my hands, and gliding down. And again, I'm not doing a huge grab, pull, pull, pull. I'm going to keep resetting that shoulder up a little bit because I want these upper traps to be soft. Right. And just soothing through and warming that upper trapezius through middle trapezius. And I'm going to turn and glide down the back of that armpit. Always using your body to guide your work. Your body gives you the pressure. My hand is nice and relaxed. And then I like to work across the body and do some upper trapezius slides that way. Then I can get into the bottom of the neck and the rhomboids a little bit. Then down that top of the scapula, getting over those rhomboids and just kind of curling around them and softening them up. And then when I want to do a little bit of upper trapezius trigger point, then I can just slide in, gather that upper trap. I use my other hand. I just lay a heavy hand on top. See how that gathers that tissue at the front there? So I can scoop my other hand in and grab the very top of that upper trap and give a little squeeze. It's going to be tender right here. Do you want less? A little less, okay. These points are always so tender, right? Everybody's got them, and they're the leading cause of neck pain, and they're a big player in headaches. So I'm just squeezing the rope itself, not a really big grab, but I want to get right toward the top of that upper trap. Little tender spots right in there. I'm just holding steady. And then soothe. And then I like to do an ulnar glide where I just take my ulna, drop the elbow way down, and hook it into that upper trap. And then you just light pressure glide the forearm over their scapula. So drop that elbow way down, glide the forearm. We can go down and out to the side. You can go up those traps and rhomboids and then out across the shoulder blade. And then I do a little glide, just checking that lateral border of the scapula. It's chunky in there. That would be real tender if I dug my hands in there. Okay. Little thumb glide across the upper trap. Nice and slow. Pressure okay? Feel it softening up a little bit in there. Yeah. And then now we're ready to do a little bit of triceps work. I like to do my triceps work with the arm hanging off the side. So we're going to drop that off. So I reposition myself, arm is off the side, I'm standing back to the side. I can still be doing these nice glides at the shoulder blade. And then now I'm getting into these triceps right here. I can go up toward the armpit and then turn my hand and glide. Up toward the armpit, get the heel of my hand in there and glide. Do that one more time. Up toward the armpit, get the heel of my hand in there and glide down. And then I'm going to start stabilizing the arm so I can anchor it there, and then I'm going to kind of wrap across the triceps. Is that okay? Little petrissage. Just be mindful of not pinching too hard or jamming your thumbs in there without being mindful of just where you are, what you're doing, what your purpose is. Okay. So we can go back to this upper corner now. There's a little oil in there. And so we're going across. Little thumb strokes. And right at that corner, now we are going to hit that trigger point. You're going to let me know, Stacy, okay? And I'm going to sink in toward the shoulder blade. It's okay? I found it. Right in this upper lateral border. And I can feel, I'm kind of like trapping right at the scapula. She's just going to take a nice deep breath. Great, and release. I really like to use my whole arm as much as possible. So I can start gliding up, just a relaxed hand, relaxed arm. Be mindful that I'm not pushing into the scapula too much with my elbow, gliding down, and then back to these triceps. Now the triceps often have some trigger points down low in this muscle. So I'm just going to do some warming. I can feel it's kind of chunky. That to me usually indicates the fascia is stuck a little bit. And when the fascia is chunky, the muscles are also holding tension below them. So I'm going to go across that tendon right there. Just warming, and this little bit of like preparation work is so valuable because sometimes the fascia is just really chunky because it's holding, but it will soften and the muscles will soften. Whatever's not stuck in tension will soften. And then it's really clear where the trigger points are. Ooh, there's a spot right there. Let me know. And so I just felt a thickness where I was saying it was chunky, and I felt into that thickness, and then I slowly pinned it 90 degrees. And then now, Stacy, you could start to straighten and bend that arm, not the wrist, at the elbow, sorry, this way. Yeah, there you go. Yeah. Feel that changing as you do that? Mm-hmm. 3 more times. 3, 2, and 1. Great. And does that point feel easier now? Yes. Great. Mm-hmm. So that can lead to elbow pain, elbow dysfunction, contribute to shoulder issues. So what I did was I just searched around in those triceps, found a spot that was a little bit chunky, and then I sank into it. How about right there? Yep. So that's kind of, if you don't know exactly where the trigger points live, you can just go for the chunky parts and sink in. Nice deep breath. Let everything relax. Arm gets heavy, whole body gets heavy. There you go. So sometimes trigger point work is kind of makes people on guard, right? Because it's a little bit intense. So we can counter that by just keep reminding them to breathe and soften into the table. And just doing some soothing. A little grab and wiggle. Great. And then what's right here next to it is brachialis. Triceps back here on the top when they're face down, and then brachialis here. And I always want to keep going back to that upper lateral border of the scapula, because that tricep goes right in between those scapular muscles, those teres muscles. Okay, compression. And then here we've got our deltoid right at the top. So we can do some squeezing, kind of milking it a little bit, dragging across. This is a great position to work the deltoid in because it's real soft in this position. Do some petrissage. And then if you come right to the bottom of the deltoid, see where you can see it kind of dives in right there. And right at this junction on the arm, see if you can find that deltoid tendon and just strum across it for just a few breaths. Circle, strum across. For some reason, this spot gets really, really tender on so many people. And it can actually limit the range of motion in their shoulder if this is kind of in lockdown. So we're just going to go across and circle. We're right at the deltoid insertion. Okay, great. Another little ulnar glide right up into that corner. Hand. And then we're going to bring this arm back up on the table. I'm going to lower my table because I can. And now I'm doing some glides down the wrist flexors. I really like working the wrist flexors when they're face down. You can trap the hand, take a soft fist glide up. Is that okay on your shoulder? Whenever you're doing arm stuff, make sure you ask them about the shoulder, because you might be so focused down here and you might be trying to hold them in a position, but what you're doing is like wrenching their shoulder. So don't do that. They'll probably not come back if you do that. And you want to just be mindful of the whole chain that you're working with. So I love to do just a heavy heel of the hand. And then I kind of anchor the hand, and then I can do the other direction. I can do a soft knuckle glide. I want to come right off the bottom of the elbow, distal, and then slide down toward the wrist. And I want to do different angles. Don't just do straight up and down, but the arm is round, right? So we want to go medial and do that glide. No, you don't have to go toward the heart. You can go down toward the wrist. It's okay. You're not going to cause them any trouble doing that. There's this sort of old myth that you're supposed to always massage toward the heart. And really, you're not going to affect their circulation that much with a few strokes going down. It's really okay. All right. And so I did straight up and down with a soft fist. And then I did the inside. And then now I'm going to do this more lateral one. See how I follow the curves of the body? That's a part that's really missing, I think, for a lot of folks. We tend to go, okay, now I'm straight down. Well, that's going to do something, but it's not going to get it all. Now I can feel the ulna right here. So I want to be on that back side of the ulna gliding down. Does that feel okay? It's tender in there, isn't it? Yeah. So I might back up a little, make sure that my fist stays soft as I glide up along that ulna. You've got extensor carpi radialis along there, or extensor carpi ulnaris along there. Great. You can grab and glide toward the body. Often when my client is prone, I do some arm work while they're face down. So this arm that I'm going to work across the body. This arm is going to stay on the table. This arm is going to come off the table. And that is going to give me space so that I can set my knee there. And I just want to ask my clients, does this feel okay? You feel okay with my knee being there? Yes. Great. So that's going to help support my body. And then that way I can be up and across and do some nice compression. Feels okay? It's all right on the shoulder? Yep. And I can even do some glides down. And some glides up. And I can do this at the head of the table. And get that whole shoulder gently down the triceps, and then a little weight into that forearm. And I can just do some nice kind of compression, glide, compress, glide, right in the meat of those flexors. They love it. The wrist flexors love this kind of like nice deep compression with a little bit of a twist, really. Feels good? Yeah. Great. And so you don't have to ignore the forearms when your client is face down. You can work from the head of the table, and you can work across the table. Nice compression and drag. Compress and drag, compress and drag. Glides medial. Pressure's okay? Yes. You got to watch for those knuckles because there's trigger points in there maybe, and you want to just be mindful. Let's take a nice deep breath, relaxing everything. There you go. Great. Okay. And then I want to just kind of tie it all together. Back of the armpit, little glides. See how I use my whole arm? I use my hand into my forearms, all the way up to my own elbow. And it just gives such a nice broad pressure on their body, and it feels so good. And then thumb glides down the traps and all the way down out the hand and all the way down out the hand. And then these little ulnar glides in the traps. And see how, again, elbow is low, gliding up. And I want to make sure I'm mindful to not go over the spine and to not jam my elbow really hard into that supromedial angle of the scapula of the shoulder blade, because you know, levator is there, rhomboids are there. We want to get a flatter compression. You don't want to necessarily dig your elbow like this. That would hurt. Okay. Down the triceps. It's really helpful to do some triceps work and trapezius work in the same session, because Janet Travell, the mother of trigger point therapy, she and David Simons discovered that trigger points in the triceps can activate trigger points in the trapezius. Triceps trigger trapezius. So if you have a client who's having lots of trapezius issues, neck pain, headaches, shoulder pain, base of the skull aching, you want to give some attention to those triceps in the same session, and then just tie them together at the end. Down the arm.